Exercise against headaches and migraines. Stinging headache, a tense neck, nausea, sensitivity to light, symptoms of a dreaded migraine attack. Such an attack can last up to 3 days. Most of the time the only thing that really helps is, take medication, close the curtains, and go to bed. But a recent study by the University of Gothenburg shows that there is another way. Exercise can effectively tackle severe headaches and migraines, just as well as common migraine medication. For their migraine study, the Swedish scientists examined 3 test groups. One was given the usual medication, the other trained according to a special sports program, and the third learned relaxation exercises. The surprising result, all test subjects had 1 less attack per month on average. Sport and relaxation exercises help in the fight against the treacherous headache just as well as medication, with convincing added value. Because if you keep fit, you also benefit from better health, more performance, and balance. Moderate endurance sport that does not move in extreme highs or lows helps against severe headaches and migraines. The positive effects on the heart and lungs as well as the reduction of stress are known. But regular exercise can also reduce the frequency of migraines, another study concludes. It is assumed that during these physical activities similar physiological processes take place in the brain as during a migraine attack, only in a weakened form. Certain messenger substances and neuropeptides, such as the calcitonin gene-related peptide, CGRP, which is relevant in migraines, are released. It is therefore assumed that regular exercise, especially endurance sport, desensitizes the migraine brain, that is, strengthens and hardens it. In addition, physical exercise can rebalance the autonomic nervous system, which in the event of an imbalance plays a key role in the triggering and severity of the attack. The study in Sweden showed that endurance exercise is just as effective in preventing a migraine attack as the prophylactic migraine drug topiramate. The guidelines of the German Migraine and Headache Society also recommend regular exercise, for example in the form of endurance training or exercise therapy, to prevent migraines and headaches. According to a German study, increasing your own fitness is a way of reducing the frequency of migraines without side effects. Sports exercises that lead to increased physical condition are therefore an alternative form of migraine therapy. However, very strenuous sports on the other hand are not suitable for preventing migraines or tension headaches. By actively dealing with the pain disorder, you can prevent avoidance and gentle behavior and recognize what you can do despite migraines. This active coping strategy will help you regain more control over the effects of your illness. Pain relief like a runner's high? During the so-called runner's high, happiness hormones are released in the pain-relieving system of our brain under physical strain. At this moment you feel euphoric, light as a feather, and free from pain. It is therefore assumed that regular endurance sports stimulate our pain-relieving system. So, as a conclusion, regular endurance training can change the way you process pain, making you less sensitive to pain.